So let's talk about hernia repair. It's actually one of the most common surgeries performed anywhere in the world, with millions of people going through it every year. But as you've probably seen, technology is always moving forward, and the choices can feel a little overwhelming. Open surgery, laparoscopic, robotic? In this explainer, we're going to jump right in, break down what these options really are, look at the hard data, and help you understand what it all means.
So here's our game plan. First up, we're going to get on the same page about what a hernia actually is. Then we'll meet the three main ways surgeons go about fixing them. After that, we'll dive deep into the numbers, and I mean everything from how long the surgery takes to how fast you get to go home. We'll also look at the risks and, whether the fix actually lasts. And finally, we'll wrap it all up and talk about what this means for you.
All right, so let's start at square one. What exactly is a hernia? When you break it down, it's actually a pretty simple idea. Just picture your abdominal wall as like a strong container that holds all your internal organs in place. Well, a hernia is what happens when there's a weak spot or even a little hole in that container. And when that happens, something from the inside, maybe some tissue or part of an organ, can start to bulge through. Simple concept, but it's a super common problem.
And when I say common, I mean really common. To put it in perspective, get this. More than 20 million hernia repair surgeries are done around the world every single year. That is a massive number, and it's exactly why understanding all the different ways to fix it is so important.
Now, you might be wondering, how do we know which method is better? Well, for this explainer, we're not just going on a hunch. We're pulling from a huge scientific review, what's called a meta-analysis. Basically, researchers took 21 different studies, which covered over 66,000 patient cases, and mashed all that data together. So this isn't just one doctor's opinion. It's a really powerful summary of a ton of data, and it gives us a super clear picture of the pros and cons of each surgery.
Okay, so now we get what a hernia is and where our data is coming from. Let's meet the three main contenders for how surgeons can get it fixed.
So even though there are three techniques, they really fall into two big camps. First, you've got the traditional open surgery. That's where a surgeon makes one bigger cut right over the spot of the hernia. Then you have what's called minimally invasive surgery. This includes both laparoscopic and robotic methods, and the idea here is to work through several tiny incisions using small cameras and really specialized tools.
First up, the classic, open repair. This is the tried and true method that's been the standard for decades. It's super reliable, and the chance of the hernia coming back is really low. But the trade-off is that it can often mean more pain right after the surgery and a longer road to full recovery.
Next, we've got laparoscopic repair. This was the first big minimally invasive technique, and honestly, it was a total game changer. By using those small incisions and a camera, surgeons could cut way down on the pain after surgery and, maybe more importantly, get patients out of the hospital and back to their normal lives a whole lot faster. And that brings us to the new challenger on the block, robotic-assisted repair. This is the latest leap forward. The surgeon actually sits at a console and controls a robotic system. It gives them this incredible 3D view and a level of precision and control that's just next level, which makes it a fantastic tool for trickier or repeat hernia repairs.
So, we have three very different ways to get the job done. But the real question is, how do they actually perform when you look at the cold, hard data? Let's get into the numbers.
Okay, the first question on a lot of people's minds is about the operation itself. How long am I actually going to be in the operating room?
Well, the data is pretty straightforward here. On average, an open repair is the quickest, taking about an hour. Laparoscopic takes a little longer, around 78 minutes. And the high-tech robotic surgery, it's the longest, at about 96 minutes. That's roughly 60% longer than the open surgery, and a lot of that extra time comes from setting up and calibrating all the robotic gear.
But, and this is a big but, is the time you spend in the operating room the whole story? I mean, what about recovery? Which one gets you out of the hospital and back in your own bed the fastest?
And this is where it gets really interesting. This is the trade-off. Even though robotic surgery takes the longest in the OR, it gets you home the fastest, with an average hospital stay of just over 1 day. That's almost half the time you'd spend after an open surgery. Those smaller incisions really do make a huge difference in how quickly your body can bounce back. So getting home faster is a huge plus, right? But that's not the only piece of the puzzle. We also have to talk about the risks involved and, just as important, how well the repair actually holds up over the long haul.
This is a big one for any procedure. Which of these methods is the safest? Which one carries the lowest risk of something going wrong after the fact?
When you look at the data, a really clear pattern emerges.
Open surgery has the highest rate of complications afterwards, at about 7.3%. Laparoscopic is a good bit better, down at 5.6%. But robotic surgery comes out on top here, with the lowest rate of all at just 4.1%. This really suggests that those less invasive approaches are, generally speaking, safer in the short term.
And now for the ultimate test, right? The real measure of success for a hernia repair is whether it's a permanent fix. So, what's the likelihood that the hernia actually comes back?
Well, the good news here is that for all three methods, the chance of it coming back is pretty low. But the data does show a small but clear advantage for the minimally invasive techniques. With open surgery, there's a 2.4% chance of recurrence. With laparoscopic and robotic, that drops to 1.4% and 1.2%. It's not a huge difference, but it is a real one.
Okay, so we've looked at everything. Time in the OR, time in the hospital, complications, recurrence. After digging through all that data from over 66,000 patients, what's the bottom line? What does this all mean for someone who might be facing this surgery?
This final scorecard really lays it all out, doesn't it? There is no single best choice that fits everyone. It's all about trade-offs. Open surgery is the fastest procedure, but you'll likely have a longer hospital stay and a slightly higher risk of issues. Robotic surgery is the complete opposite. It takes the longest in the OR, but it gets you home fastest with the lowest risks. And laparoscopic sits right there in the middle, a solid balance of both.
So the biggest takeaway here is that the right choice is going to be different for different people, and it's a decision you make with your doctor. It really depends on your health, the specifics of your hernia, your surgeon's comfort level with each technique, and frankly, what matters most to you. Is it the speed of the surgery or the speed of your recovery? This data is here to empower you, so you can have that conversation and ask the right questions.
And that leaves us with one last thing to think about. As these robotic systems get even more precise, and as surgeons get more and more experience with them, are we heading toward a future where a surgeon is less of a craftsman with their hands and more of a high-tech pilot navigating these complex internal spaces with unbelievable precision? It's a pretty wild thought as medicine keeps rocketing forward. Thanks for joining us for this explainer.